Well, as the US begins its program of enhanced screening this weekend at 5 of its major airports, including JFK, one American epidemiologist says that the country should stop all flights from West Africa to prevent more outbreaks. Well, we can speak to Professor David Dausey, the founding director of the Mercyhurst Institute of Public Health in Pennsylvania. He joins us now. Professor, thanks very much for joining us. Now, I appreciate that, the death of Thomas Eric Duncan, the man who travelled from Liberia to Dallas and then subsequently died, gave the United States a wake-up call. But stopping flights from these affected countries, is that not cutting them off when they need help the most?
I would say that that is suggesting that the commercial airlines are the only ways to get food, supplies, and aid workers into the country. And actually, I think if you look at this, the commercial airliners don't want to be co-opted to become first responders. Many of the airline employees don't want to go there. A better way to do this is through the militaries of Western countries, which have logistical capabilities which are much stronger than commercial airlines. We can't rely on commercial airlines to do this type of work.
But people can still get into the United States via other routes, not directly from the affected countries.
Of course, they can get in through other routes, but it depends on what you do in terms of flight restrictions within the country. Certainly, there are common sense things we can do to potentially limit flights from the country for a short period of time so that we can have some societal order created on the ground and so that we can also contain the virus more effectively.
With the case of Thomas Eric Duncan, he was misdiagnosed, but somebody coming into the United States, now that the country has woken up to the gravity of this disease, is there not a case saying that they would be getting the best medical treatment effectively in the world in a country as rich as the United States?
Certainly, the United States does have an impressive healthcare system that is able to treat the disease. But certainly with something like Ebola, it is a very challenging disease to deal with. And even with the best healthcare in the world, you could still potentially die from the disease.
When it comes to the figures, the West especially has been criticized for being very slow to react to this disease. Why do you think that is?
I don't know. I think that it's a shame that it has been too slow. I think one of the things that is happening here is that the international community has not mobilized quickly enough to respond to this outbreak. Part of it is that we're relying on things like commercial airliners to do the job that militaries should be doing and do the jobs that these other Western countries that have the capabilities to get into those countries and help should be doing, but we're not.
Okay, Professor David Dausey from the Mercyhurst Institute of Public Health joining us from Pennsylvania. Thank you very much for your time.
Thank you.